10 signs of kidney disease you should never ignore. Our kidneys play a crucial role in maintaining overall well-being, and recognizing the signs of kidney disease early can make a significant difference. Do you often feel exhausted, no matter how much sleep you get? Or have you noticed changes in your sleep patterns lately? What about that persistent itchiness? Or have you noticed changes in your urine, like increased frequency or blood? These could be signs of kidney disease, a condition that affects millions worldwide. But often, these symptoms go unnoticed or are attributed to other causes. In this video, we will discuss 10 common signs of kidney disease that you should never ignore. Fatigue and weakness. Sleep disturbances. Dry and itchy skin. Increased urination frequency. Blood in urine. Foamy urine. Muscle cramps. Nausea and vomiting. Swelling, edema. Shortness of breath. Number 1. Fatigue and weakness. Fatigue and weakness are common symptoms of renal illness caused by several factors, including a buildup of toxins in the blood, anemia, hemodialysis, poor sleep, itching, restless leg syndrome, and cardiovascular problems. Symptoms of fatigue include exhaustion, low energy, difficulty concentrating, stress, depression, loss of interest in activities, and bad memory. Weakness is characterized by low strength limiting daily chores. If you have any of these symptoms, talk to your doctor or nurse to determine the underlying cause and develop a treatment plan. Number 2. Sleep disorders can indicate renal illness. Sleep difficulties affect up to 80% of end-stage renal disease patients. Delays in sleep start to indicate these diseases, reduced sleep time, efficiency, and frequent awakenings. CKD patients may have insomnia, obstructive and central sleep apnea, restless leg syndrome, periodic limb movements, excessive daytime drowsiness, sleepwalking, and nightmares. End-stage kidney disease, ESKD, patients have a 44% prevalence of sleep disturbance, which renal healthcare practitioners often overlook. Metabolic changes, inflammation, CKD consequences and symptoms, concomitant illnesses, drugs, and dialysis all have the potential to disrupt sleep. Sleep abnormalities can indicate renal illness, although other disorders can also cause them. Therefore, we must consult medical professionals for diagnosis and treatment. Number 3. Increased urination frequency. An increased frequency of urine may indeed indicate renal disease. The urge to urinate can rise when the kidneys' filters are compromised, especially at night. On the other hand, various conditions, including a urinary infection, an enlarged prostate in men, or even lifestyle choices like drinking too much water or coffee, might also be linked to frequent urination. It is noteworthy that, despite being linked to kidney disease, frequent urination can also be a sign of bladder problems. See a healthcare professional for a proper evaluation to identify the underlying cause and the best course of action if you're experiencing an increasing urine frequency. Number 4. Blood in urine. Hematuria, blood in the urine, may indicate kidney disease. Blood cells leaking into the urine can indicate glomerulonephritis if the kidney filters are compromised. This illness inflames the microscopic kidney filters that filter blood. However, urinary tract infections, UTIs, kidney stones, and bladder difficulties can also cause blood in the urine. Some medications or foods may cause it. Thus, blood in the urine is not always a sign of renal disease. If you have blood in your urine, see a doctor to diagnose and discover the cause. Don't forget to hit the like button and subscribe to our channel so you never miss out on our new informative videos. Number 5. Foamy urine. Foamy urine, especially if persistent, may indicate kidney illness. Proteinuria causes urine foaminess. Proteinuria indicates kidney filtering system dysfunction because healthy kidneys prevent protein from entering the urine. Renal disease is not the only cause of frothy pee. Rapid urine flow, dehydration, chemicals in the toilet bowl, or drugs can also cause it. Consult a doctor if you frequently have frothy urine. Urine tests can detect protein levels and kidney problems. While frothy urine may indicate renal illness, it is not conclusive. Healthcare professionals can diagnose the cause thoroughly. Number 6. Muscle cramps. Muscle cramps are sometimes a sign of kidney disease, but they are not usually caused by the illness itself. Instead, they may happen as a sign or complication of kidney disease because of things like a lack of electrolytes, especially potassium and calcium, dehydration, nerve damage, neuropathy, or side effects from medications. When someone has kidney disease, their kidneys might be unable to keep electrolyte levels in check or get rid of waste from the body properly. This can cause changes and make muscle cramps worse. Chronic kidney disease, CKD, and other illnesses can also cause fluid imbalances and dehydration, which may also cause muscle cramps. Number 7. Nausea and vomiting. Nausea and vomiting can indeed be signs of renal disease, especially when the illness advances to more severe stages. These symptoms are caused by an accumulation of waste materials and extra fluid in the body, which the kidneys are unable to adequately filter out. When kidney disease is present, symptoms such as fatigue, altered urine patterns, edema in the feet and ankles, and appetite loss are frequently present, in addition to nausea and vomiting. It's crucial to understand that although renal illness may be the cause of these symptoms, several other medical conditions may also be to blame. A medical professional can run tests to identify the problem and administer the proper care. Number 8. Swelling, edema. Kidney illness can cause edema. It is common when the kidneys cannot eliminate extra fluid. This can cause fluid retention and edema in the ankle, hand, and face. In kidney disease, especially CKD and ESRD, the kidneys lose their ability to filter and balance fluids. Edema can result from hypervolemia, which causes fluid retention. Damage to the kidneys' filtering blood vessels can induce nephrotic syndrome, which causes edema and low blood protein. If you have persistent edema and other kidney disease symptoms, visit a doctor. A doctor can diagnose and treat edema. Lifestyle adjustments and pharmacological treatments can minimize kidney disease edema and avoid additional consequences. Number 9. Shortness of breath. Kidney disease can cause shortness of breath and muscle cramps, but these are not clear signs of the disease itself. Instead, they may happen because of complications or conditions that are linked. For example, shortness of breath can be caused by kidney disease because of pulmonary edema, which is when fluid builds up in the lungs. This can happen if the kidneys aren't clearing out enough fluid from the body. This buildup of fluid can make it hard to breathe. Electrolyte issues, dehydration, or nerve damage can all cause muscle cramps. All of these things can happen when you have kidney disease. However, both shortness of breath and muscle cramps are general symptoms, which means they can happen for a lot of different reasons besides kidney disease. It's important to think about other things and talk to a doctor to get a good diagnosis. Number 10. Dry and itchy skin. Kidney illness can cause dry, itchy skin. Kidney problems can damage the skin. Increased blood waste products can cause CKD patients to develop uremic pruritus, a form of itching. It doesn't cause a rash, but scratching might irritate and redden the skin. The back, face, and arm may experience generalized or localized itching. Dialysis patients often have dry skin. It usually affects the arms and legs. Decreased kidney function can lead to skin abnormalities, such as color changes from toxin buildup. Nails change. Swelling. Rashes. Blisters. In conclusion, renal illness can cause dry, itchy skin. Consult a doctor for a proper examination and treatment of skin changes. It's important to remember that these symptoms can also be caused by other health conditions. If you're experiencing any of these signs, it's crucial to see a doctor to get a proper diagnosis. Early detection of kidney disease can make a big difference. Thanks for watching. Don't forget to like, share, and subscribe for more health tips and information. Take care of your kidneys, they're vital for your overall health.